Good afternoon. I want to talk about a core issue that has defined my journey through this course, namely the structural inconsistency that exists in delivering rural health care within the United States. We ask our community hospitals to function as essential public safety cornerstones. We expect them to be stable, unyielding sanctuaries for our families, yet we require them to operate within a highly volatile, market-driven financial constraint. This institutional vulnerability is not theoretical, it is a reality I navigate daily as the Director of Physician Services at East Liverpool City Hospital, which is a 118-bed, nonprofit community hospital that has proudly served the upper tri-state panhandle for 121 years. While we manage our baseline operational expenses efficiently, our safety zone remains incredibly fragile. This course has challenged me to bridge the gap between abstract financial theory and the messy human realities of corporate and public governance. One of the primary objectives of this course was learning how to handle these intricacies of balancing competing groups' needs in day-to-day operations while advancing long-term strategic goals. In a healthcare facility, every department believes, and often rightly so, that their financial need is urgent. On a day-to-day level, we manage an annual revenue stream of approximately $84.7 million. On paper, that sounds substantial. However, 98.3% of that is tied directly to patient care, which is dependent on lower-paying government programs like Medicare and Medicaid. This reality creates an immediate squeeze. Annual staffing costs consume $45 million and $52 million to maintain roughly 689 full-time equivalent employees. Simultaneously, our aging infrastructure demands between $8 and $11 million annually just for basic maintenance and compliance upgrades. As a leader, you are constantly caught between these two massive forces. If you overallocate to physical plant maintenance, you risk starving your workforce, causing labor talent drain to metropolitan markets like Pittsburgh and Cleveland. If you overallocate to immediate compensation demands, you neglect the structural safety of the building itself. Through our analysis, I learned that a leader cannot treat these as isolated decisions. We must look at 5-year forecasts. ELCH faces a $15 million projected capital need over the next 5 years, $10 million to overhaul the East Wing, HVAC system, and digital EHR system, and $5 million for workforce stabilization and training. Balancing day-to-day expenses with these multi-million-dollar long-term goals requires a framework that links daily fiscal discipline to ultimate long-term survivability. This brings me to the second core theme of my reflection: maintaining an unemotional rationale in decision-making. Modern financial theory assumes that organizations operate like computers, processing data rationally to optimize choices. But as Morgan Housel notes in his textbook, real-world fiscal management operates like fluid, emotionally driven psychology. When an executive transitions from personal financial practices to corporate governance, their behavioral patterns form a blueprint that directly dictates their leadership style. I have learned that the habits formed in personal financial disciplines, such as budgeting for structural flexibility within a large household, translates directly into building necessary institutional buffers to insulate an organizational supply chain and shocks from emergency room volume surges. To remain objective, a leader must actively combat what Dr. Jason Hubbard describes as fear-based leadership behaviors, which can paralyze organizational success. We must also recognize the shortcuts or heuristics that Roworda and DeGraff note leaders use when making complex financial choices under tight deadlines. To keep my eye firmly on the unemotional objective rationale, I have implemented 2 major lessons from these literatures in my approach. Treating a budget as an instrument for long-term operational flexibility rather than an emotional restriction. This allows me to authorize physician practice budgets objectively, aligning resources where they yield the highest clinical return rather than acting out of a defensive lens of scarcity. Moving away from accommodating the loudest requester, whether managing complex emergency room provider payrolls or evaluating wage increases, compensation must be tied to objective metrics such as market data, relative value units, and productivity indicators. Data scales, emotional reactions do not. A true test of a public leader's readiness is their ability to secure funding for critical projects without exposing the public or the organization to toxic debt. Because ELCH is a private, nonprofit, public charity, it cannot independently issue municipal bonds or directly levy taxes. The culmination of my work in this course was designing a proposed public-private partnership, P3, framework that solves our $15 million capital crisis through a dual-track municipal framework. I propose utilizing the local municipal government as a conduit issuer. Because these are revenue bonds, the debt service is paid back entirely by the hospital through our expanded high-margin outpatient and urgent care clinic revenues. This carries a zero general municipal liability, insulating local taxpayers from debt risk while immediately eliminating the $11 million annual facility maintenance drain. To fund our workforce stabilization, I propose a localized property tax levy generating $1 million annually over 5 years. This revenue is legally fenced and restricted to workforce fund to squash nursing turnover. By blending data-driven executive leadership with this unobtrusive public-private design, we insulate the hospital from capital scarcity while honoring the public's trust. In conclusion, how prepared do I feel to take on a top leadership role dealing with public funds in a public organization? Before this course, financial administration often felt like a series of reactive defensive measures designed to keep the lights on for another quarter. Today I feel distinctively prepared. This course has given me the administrative vocabulary, the theoretical backing from Housel, Hubbard, and Rewerda, and practical modeling tools to view public finance as a proactive instrument for institutional excellence. I am ready to step into high-level governance because I understand that safeguarding public funds requires a blend of rigorous data analytics and deep psychological awareness. I know how to design funding frameworks that protect taxpayers, how to establish objective merit systems that protect workforce equity, and how to build structural buffers that ensure operational resilience. Thank you for watching, and feel free to contact me for any questions or comments.